Hello everyone. Today I'll be taking another VivaLive session with QQSphere on the topic virology under the subject microbiology, and with a subtopic we'll focus on HIV. Let's start.
Hello there. Welcome to your virology examination. We'll be focusing on HIV today. Let's start with the basics. Can you describe the structure of the HIV virion? This information is for educational purposes only and should not be considered medical advice or diagnosis. Always seek the guidance of a healthcare professional for any health concerns.
HIV is an enveloped retrovirus with 100 nanometer diameter. It has an envelope uh, with glycoproteins GP120 and GP41. It has a capsid P24, a genome which is a single-stranded RNA in positive sense, and enzymes are reverse transcriptase, integrase, and protease. It also has a matrix P17 located beneath the envelope, which provides structural integrity.
Excellent. That's a very comprehensive description of the structure. You mentioned that HIV is a retrovirus.
Yes.
So, how does that classification relate to its replication cycle? What's special about the way it copies its viral RNA?
Um, it is a retrovirus, which is a which replicates with a specialized process where single-stranded RNA is converted into double-stranded RNA using reverse transcriptase, and then it integrates into the host genome.
Exactly. That enzyme, reverse transcriptase, is crucial. Now, thinking about clinical progression, which specific cell type in the immune system does HIV primarily target and destroy, leading to immunodeficiency?
HIV virus primarily targets the CD4 cells, which are CD4 T lymphocytes, helper cells. They protect the body from infections. So when their count decreases, the body gets susceptible to a number of uh, infections.
Exactly. The depletion of those CD4 helper T cells is a hallmark of the disease. Now, clinically, how would we monitor a patient's condition using specific laboratory markers? Which parameters are most important to track?
Uh, we will focus on CD4 count, uh, and we can uh, we can check
Yes,
CBNAT
the
also.
CD4 count is one. What about measuring the amount of virus itself in the blood? What's that test called?
Uh, uh, we check for HIV antibodies, antigens, which is P24, or the virus's RNA to detect in blood or saliva.
Yes, checking for the viral RNA is called viral load testing. Now, sometimes individuals might be exposed to HIV through a high risk event. What kind of preventive measure could be taken immediately after that potential exposure? We call it PEP. Can you tell me what that involves?
Uh, HIV prophylaxis involves pre-exposure and post-exposure treatment, uh,
That's
which
right. Pre exposure prophylaxis or PrEP is taken consistently beforehand, and post exposure prophylaxis or PEP is started within 72 hours of a potential exposure. Moving on, are there any particular opportunistic infections you recall that commonly affect individuals with advanced HIV infection? Can you give me an example?
um, the opportunistic infections that can occur are fungal infections, pneumocystis jirovecii, pneumonia, candidiasis, cryptococcal meningitis, and pulmonary TB, extrapulmonary TB, cytomegalovirus, herpes simplex virus, toxoplasmosis, cryptosporidosis, and Kaposi sarcoma.
Excellent. You've covered quite a range of infections and even mentioned Kaposi sarcoma, which is related to another virus. That brings us to the end of the examination. You've demonstrated strong intermediate knowledge of HIV.
Thank you.